you know we had to help you live your best life. It's Valentine's Day. A good reminder, actually, to keep your heart healthy.
Yes, that's right. You know, you get your blood pressure checked at every doctor's visit, but do you know what the numbers should look like and what you can do if the doctor's concerned? We're joined by Dr. Atul Chugh from Franciscan Health. Dr. Chugh, welcome.
Dr. Chugh.
Good morning.
I have to give you a quick shout out because he is on the cover of Indianapolis Monthly as one of the top doctors in our area.
Yeah, that's awesome. Congrats.
Thank you. It was an off year. What are you going to say?
Very humble.
Yeah,
Very
exactly.
humble. He's like, oh,
exactly.
this old
Oh,
thing.
this old thing?
Yeah.
Yeah, put it into the basement. Congratulations.
No,
That
it's
is
an honor.
incredible.
It is an honor, and of course it's an honor being here because I think to be able to talk about health in such an informal way, trying to make health a little bit more accessible to everyone, and the way in the format in which you guys do it is so cool.
Well, thank you.
I really want to thank you for doing this for the community.
Well, thanks. You know, February is Heart Health Month, and we've been learning all about it. So you're talking about hypertension and blood pressure today. Why is that bad for our heart, Dr. Chugh?
You know, it's a great question. And, you know, obviously, when you look at these numbers, they seem kind of esoteric. Like, what do these numbers mean?
Yeah.
What it is imagine, if you will, the heart's a pump, and the blood vessels of your body are the piping that's connected to the pump. Well, if the pipes are getting stiff, then, of course, the heart's having to work harder to push that blood through the pipes,
Okay.
right?
Yeah.
Now, as the blood pressure increases, there are two things that happen. Number one, the heart is working harder. So if we were to work out and we were, Planet Fitness every day, and we have these big muscles, fantastic. The heart, not so much. You don't want the heart to have a lot of muscle because that means it's using a lot more energy than it needs. And so you want the heart to be more of a sirloin than a fillet. That's what we always say.
Oh, I like that analogy.
That's nice.
I've
That helps
never
me
heard that. I
understand
like that.
No, I got plenty of these. We got.
He's like, I'm here all day.
No. I do tricks. It's the whole thing. So the long and the short is we have that portion. Now the other thing that we always have to remember is because the pressure is more in the pipes, what that does is it puts a little bit more pressure on the walls. So if the walls have more pressure in them, that allows for cholesterol to enter the walls of the heart,
That makes
or
sense.
the vessels rather,
Yeah,
and that's
okay.
called atherosclerosis. Now, of course, as that builds up in the heart, that can lead to heart attacks. If it brings up in the blood vessels of the brain, that's a stroke.
Okay.
If it's in the legs, it's peripheral arterial disease. So all in all, hypertension leads to these really bad issues, and that includes heart attack, stroke, heart failure. Those are the three big ones.
Okay.
And it's important that you are talking about this because we see the numbers, we see the statistics. Why is this disease so prominent?
It's such a great question. And actually, I don't know if everyone, what's so harrowing about the whole thing is by the time you're 55 and the time you're 65, the average people, male and female, 90% of folks will have high blood pressure. So, in other words, more likely than not, if you make it to 55 or over, more likely than not, you're going to have hypertension, and more likely than not, you're going to have hypertension.
Wow.
90% out there. So, the reason why it's becoming more and more prominent is because of, I think, one of the major issues is obesity, right? And the increased amounts of salt in our diet. And we'll talk a little bit more about lifestyle changes that are within our problem. But again, the prevalence of those two are so high, right?
Okay.
The average American eats about 3.6 grams of sodium. We should be eating about 2 grams a day, so we're about eating double of what we should
Of course
be
we
eating.
do. Man.
Wow. Dr. Chugh, are there any other quick lifestyle changes? We've got about 30
Yes.
seconds left that you can give our viewers to take care of our hearts.
You know, I think that just to be very deliberate about what we do with our bodies, right? So the three things that we want to think about is salt. So keep your salt down, watch those labels. Number two, the most important thing, one of the things that was really coming out is sleep. We know that the quality of sleep and the amount that we sleep is really important. So if you have a condition known as sleep apnea, get yourself screened. And the third thing, of course, work on the weight loss. Now, I know that's easy to say, but if we have a deliberate way to do it, sleep will beget weight loss. So all of it's sort of contained.
connected.
Exactly
Yes.
right.
Dr.
Yeah.
Chugh.
Oh, man, I'm getting 8 hours tonight.
Yeah,
Thank you
gotta
so
get those
much.
8. Dr. Chugh, thank you so much for being here, and
Thank
thanks
you
for
for being
sponsoring the
here.
show through
Yes, we
Franciscan Health.
appreciate you.
Oh, no, it was a pleasure. Thank you so much.